Our simulation program is aligned with healthcare simulation and safety by, first off, just general clinical skills, as well as non-technical skills. But more importantly, we're really focusing on our IPE programs to really impact healthcare systems. We all know to err is human. We know that getting teams together to practice even high risk, situations and being able to talk about that afterwards can really help build patterns for the teams to bring into their practice and improve their actual practice. So that's probably where I see the most benefit of IPE simulation specifically to really impact healthcare quality and improvement beyond the individual silo level. Most of our programming is focused first on making sure that our caregivers are ready to enter their professional lives, whether they're new novice providers or nurses. Also working on the specialty specific knowledge and skills that they need. So there's a lot of specific content in onboarding, but beyond that, it's professional development. We do some simulation program related to assessment, so some high stakes simulation to make sure that we're meeting, the needs of our patients and make sure that we have competent individuals who are ready to take care of whatever's coming their way. I think the biggest thing is really creating, first off, a psychologically safe environment so that people feel like they can engage. And when you've got your team bought in or your learners bought in, they are going to tell you the problems. They are going to firsthand tell you the issues, in addition to learning and advancing themselves as lifelong learners. But probably the biggest thing we do is we take that feedback about system threats, whether it's latent safety threats or potential process issues, and we have a specific process to make sure that their feedback on both mitigating the issue is brought into policy and into change. So, really creating kind of a high reliability organization concept is really where it's at to me. For sure. So in my experience, I've been at 3 different places in my simulation career, and I found that when simulation starts without being completely integrated as a concept, that's where the barriers happen. Because then education or the simulation team sort of is working in their own silo rather than being a fully integrated part of the system. And so for me, it's really aligning the goals of the simulations with the executives and all of the different quality and patient safety individuals and really telling a story. So it's not just the data, it's really telling the stories. So to me, that's the biggest thing. For sure. So VR and augmented reality is so unique, so immersive, and it's so exciting to see how it's been growing. And I'm really seeing that it has impact and quality by its ability to harness communication and harness getting teams together without necessarily even having to be in the same place. So to me, the power in VR and AR is really bringing the teams again together to be able to work and hone in on their communication, really understand each other's roles, and be working with the same framework for whatever the situation is that they're working on.